Hello and welcome to the Unfiltered Experience with Tara and Louisa.
We are two girls who speak the truth about the struggle of never feeling enough whilst growing up in a world of filters and comparison.
Here we will have raw, relatable and authentic conversations to empower you on your path to self-development.
Come with us on the journey of unlearning. Hi guys, and welcome back to the Unfiltered Experience. This week we are jumping into part 2 of my interview with Dr Gabrielle Klepfisz. She is an addiction psychologist, but in this episode we discuss trauma therapy and the different modalities on how to heal trauma. We discuss motherhood and the pressure that mums have on their mental health and some tips in order to deal with the load of parenthood, and we discuss navigating the epidemic of anxiety and how to heal your anger. If you liked this episode, please feel free to follow for more episodes, share it with someone that you love, or send us a review.
There's a lot of stuff online now about mummy wine culture.
Wow.
So I don't know, have you seen any?
No.
And yeah, it's very much talked about at the moment where mums, and it was kind of a satirical thing, that mums were turning to wine to cope with parenthood. And there's like a lot of memes out there, a lot of images that were making fun of the fact that it was wine o'clock or something that, you know, women were needing wine to get through the day. But there's also been the other side where people are raising a lot of concern around how alcohol's been really normalized as a coping mechanism, and that women are being targeted by advertising for that very specific reason. Like, you know, you've had a hard day, have some wine. There's been a lot of shame, which I don't like seeing around it, because I think the bigger question is, why are women feeling like they need to, rather than let's shame women for turning to alcohol? Like, let's understand why things are so overwhelming. And I think obviously this is a much bigger topic than today, but like the demands to be a career woman and a mother and hold it all together are huge. As a working mum myself, like it's so overwhelming at times. So naturally people are looking for that stress relief. Unfortunately, advertising and media are really pushing alcohol to be the thing.
Other than wine, what are ways, like small ways, that you can fill up your cup as a mother or soothe yourself when there's so much demand on you? Are there any tips that you've got for any like new mothers or people going through parenting that are running on that empty tank?
Such a good question and such a big question. I think that first and foremost, if you're struggling, know that it's okay to ask for help. I feel like so many mums and women feel like we need to do it all and we should just be able to hold it together, because that's what kind of the messaging is. And it is damn hard. It is really hard, A, just having kids, and then B, trying to work and have kids and do everything. So knowing it's okay to struggle, and whether it's a friend, a partner, a mental health professional, reaching out for help if it feels too much, having somewhere to talk about what's going on is so important. And then filling your cup up. I mean, sometimes it feels like it's not even possible, but it's the small things like, you know, really trying, once things settle with a newborn, obviously, both you and your partner having time to do things that you enjoy, whether that's together and separately, not always feeling like everything is just about being at home, managing the household. So, you know, if that's going to Pilates, if that's going for a walk with a friend, if that's whatever it is, something else, making sure you find those things that do recharge you. And I think there's a difference between kind of nourishing yourself and also recharging. So finding things that are soothing but also energizing, like what energizes you, which can be really hard when you're in the trenches. But where possible, it might be tiny things like at the end of a long day, having some quiet time, your favorite cup of tea, reading a book. It doesn't have to be anything expensive, but just making sure that there are little things.
And time reserved for you that are guilt-free.
Yes.
Because I think that's sometimes the battle, is that reserving that time for yourself. I mean, I'm obviously not a mum, but I witness people going through new parenthood, and the guilt associated with putting yourself first here and there can be such a driver to not look after yourself.
I think that analogy of being on a plane and fitting your own oxygen mask first really applies here. To be the best mum and parent that you possibly can be, you need to tend to yourself as well. It is no good if you are burnt out, because I know I am not my best self when I'm feeling burnt out. I'm more, snappy, less patient, not always the parent that I would love to be, which is human and normal. But I know that if I have time to do some of those things and fit my own oxygen mask first, I have more of that patience, more fuel in my tank to give to other people.
I love that. That's great. That's beautiful. And I think that's something in any area of your life, in relationships, friendships, family, dealing with work. We have to water our garden first.
Yeah.
Otherwise, we're not going to, it's not sustainable, really. In practice, what are you seeing an epidemic of? Like, what is the most common battle that people are dealing with in this day and age, do you think?
God, I think anxiety is huge. There's a book, I haven't read it, so I can't say what's in it, but there's a book called The Anxious Generation, I think it's called. And my understanding is it talks about how social media and smartphones are really playing into a lot of that. And certainly, what I've seen in terms of body image, people spending so much time on platforms like TikTok, just comparison to other people, access to some gruesome stuff online that, especially at a young age, people should not be seeing. Like, I think that is hugely contributing to anxiety. And there's so much trauma. There is so much trauma in our society. Like, this isn't, statistics based, but everyone I see has some kind of trauma that they need to deal with. Now, whether that's because that's kind of how I'm marketed, like, substance use and working with that, or that's something to say about our kind of generation and society. But yeah, there's a lot of hurt and a lot of pain.
How do you treat trauma? Like, how does one start with that?
Yeah. There are various modalities. Evidence-based practice, so there'll be like a list of frontline treatments. Me personally, I'm trained in EMDR, which is eye movement desensitization and reprocessing, and also schema therapy, along with some of the other modalities that I weave in, like CBT and ACT, but they're kind of my two preferred modalities for trauma. Other people use other kinds of modalities as well, like, there's exposure therapy, there's, I think, CPT and other kind of modalities. So there are various treatments that are kind of endorsed by the World Health Organization, but for me, EMDR and schema therapy are my...
Do you want to tell us more about what they are and how they work and what that means?
Yeah, I'm going to butcher it.
That's fine.
So EMDR, and it sounds kind of woo-woo when you first hear it, but there is a lot of evidence behind it. It's basically a treatment modality that it's got 8 phases, but the phase that everyone knows about and how it kind of got its name is that you use bilateral stimulation, historically in the form of eye movements. So I don't know if you've ever seen a video of someone going like this and following the eye movements whilst bringing to mind the trauma. And essentially what happens is through the bilateral stimulation, which can also be tapping or audio, but eye movements is traditionally what it was, and holding in mind the trauma, you are processing the trauma while also taxing your working memory by doing another task. And doing those two things together, in essence, and this is a very simplified explanation, reduces the distress associated with the trauma, makes it less vivid, can kind of help shift some of the negative cognitions associated with it and the felt sense of it. And then there's a phase where you kind of help bring adaptive information to reprocess that, and EMDR says install more positive adaptive information about that trauma and yourself.
Wow.
That's a very kind of simplified, butchered explanation, but it's amazing.
Well, I do brain spotting.
Okay.
Which I think is similar.
Yeah.
However, the stick is still.
Okay.
And you have headphones on, and you, depending on what you were just saying, you keep in mind the event or the feelings associated. Sometimes my therapist will get me to like write a letter if it's hard to sort of activate the feeling. So I'll bring that letter into the session, activate the feelings associated with whatever I'm trying to process. And depending on where the stick is and where I'm looking across the room, I'll feel the feelings either rise up or I'll go numb almost. And I've had some wild experiences.
I'm sure they probably have similarities.
What is schema
So
therapy?
schema, yes. So schema's a third way of cognitive behavioural therapy, but basically schemas are beliefs we form about ourselves, other people, and the world around us through our experiences in childhood and then, as we grow up. They're more than just beliefs, though. They're kind of like our emotional wounds, our triggers. And so we all have schemas. We just have different ones depending on our life experiences. And so schema therapy is all about looking at how schemas are playing out in the present moment, how we respond when they're triggered, and then you've probably heard about inner child work, but schema therapy is about building the connection between your healthy, wise adult self and that vulnerable child within, and building up the healthy adult. So whether that's coping skills, assertiveness skills, whatever needs to kind of be built up there, and learning how to soothe that anxious, lonely, abandoned, rejected part. And part of schema therapy involves some imagery rescripting, so of past experiences.
Wow.
Yeah.
What does that look like in practice?
So you might go back to a childhood memory and, you get the client to imagine it in as much detail as possible. Initially, the therapist might come in as the healthy adult.
Okay.
And depending on what the memory is, there might be a perpetrator that you confront and you rescript the memory. And then over time, hopefully the client's healthy adult has been built up that they can come in as their own healthy adult and support the child to do what's needed in the memory and to be there with the child.
And do clients then carry that out post session? If they get activated day to day, will they use that healthy adult dialogue to coach themselves? Is
That's kind of the hope over time. You're building up that dialogue, the skills, all of that over time, and hoping that the inner critic and the demanding critic inside are softening. Coping modes like substance use to detach are also kind of softening, and that healthy adult is really strengthening.
One thing I like about EMDR or brain spotting, which I think sort of functions similar, is that what's attractive to me about doing that was you don't have to face talking about it. It's like you can work to integrate the memory or have the symptoms of the trauma, whether there's PTSD or whatever, or the trauma responses, they can be alleviated without having to rehash and feel all of that stuff again. It's quite amazing.
That's what appealed to me about learning it, because I know historically prolonged exposure was, one of the main therapy treatments for trauma. That to me sounds really hard, to rehash and expose yourself to every detail of a trauma again. I wonder if some people would be re-traumatized by that. So EMDR, definitely it's the same. You don't have to, you can give just a headline like the assault, and that's it. And you don't have to rehash it. You just have to be able to bring to mind an image that depicts the worst of it, and your brain does the work. You kind of want to step out of the way and just let your brain do its thing.
Yeah, wow. It's like a physiological...
Yeah, it's amazing. And there's still debate exactly around the mechanisms that make it work, but the evidence shows it does work.
Long-term in clients that you've done EMDR with, do you see a result? Do you see the reward of that therapy?
It's funny because the clients I've done it with and there was good results, they then end treatment and they haven't come back.
Wow.
So hopefully that's a good sign.
Yeah, we'll take it.
But in the sessions, certainly, you get a subjective rating of distress and it goes down massively. And, what might have been a 9 out of 10 distressing event at the beginning of processing might be a 1 or 0 at the end.
Wow. And hopefully that is maintained. That's awesome.
Yeah.
My experience with brain spotting is that it takes a while, the processing continues after the therapy. It's not like you're just fixed straight away. But then a few months later, I feel so much better towards whatever it was that was triggering me, and it feels like it's been processed. It's quite amazing.
Yeah, EMDR is definitely not a quick fix. Like it's hard work still, and it's exhausting. And, you know, we often say like your brain will continue to process, as you said. So that could, you know, you might have dreams, other memories might come up, and they can also be processed. So it's not a quick fix. It's not easy work, but the effects are really amazing.
What are some key takeaways that you would give to anyone listening to this episode that might be struggling with anxiety or at the beginning of their self-development journey? From a psychological standpoint, what is something that can empower people to have higher self-esteem? And what are some healthy soothing techniques? Because we've talked a lot about trauma and addiction and unhealthy sort of ways to soothe. What is the opposite of that? So what would healthy soothing as an adult look like? Because a lot of us aren't really taught that as children. Like, I mean, you know, your kids and like the generation now will probably be a little bit more equipped than what we were.
I think that there's so much power in taking a pause when you're triggered, whatever the trigger is, pausing, letting yourself slow down before feeling like you need to react to something. Because what happens is when you're triggered, you've gone into fight and flight mode. And basically the thinking part of the brain's gone offline. It's not active. You're in your amygdala and everything is going to feel like a bit of a threat. That's where anxiety is happening. So if you can pause, if you have the capacity to pause, slow down, if you need a timeout, take some time, do some deep breaths. I really love just kind of placing a hand on my heart and just checking in and like, what do I need right now? And it'll be very different depending on, you know, sometimes anger has an energy that needs to be discharged. So you might be like, okay, I need to get outside and go for a walk. Sometimes it's like, I feel really upset. I just need to take some deep breaths and do something more soothing than kind of energetic. Maybe I'll have a warm shower, calm down. When I can think clearly again, then decide what I'm going to do with whatever's just happened. I think that if you can slow everything down and check in with what you need, even naming the feeling, because they say if you name it, you tame it. So naming, like, is this anger? Is this sadness? Is this anxiety? And what is it trying to tell me? And I think there's always a light bulb moment for clients when I say that emotions aren't good or bad. So we are socialized to think, especially as women, anger, bad. And joy is everyone is comfortable generally with those kind of more positive emotions. But actually they're all neutral. They all communicate something. So if you can have the capacity to check in and say, what is this and what is it telling me? If it's anger, has someone crossed a boundary? Has there been an injustice? If it's sadness, like have I lost something important to me, or what's happened? So they're all telling us something if we can slow down and have that capacity to just kind of check in. Easier said than done, but...
That was, I love that because that was really tangible. If you name it, what was it? If you
name it to tame it.
Name it to tame it. Your answer just prompted this question because my partner and I have talked a lot about recently about dealing with anger and how to express healthy anger and how, like, you know, we're not taught that as children. We're either throwing a tantrum or raging. And for women, like for me, I really suppress it and then it might come out sideways later and I just have an outburst of emotion. What are some ways to express healthy anger? Is it in the moment? Like, how does that look?
I love talking about this with people because so often people are like, oh no, can't express anger. And that'll look, again, it will depend on your capacity in the moment. Very often there will have to be a pause, removing yourself from the situation before you can express it. Because anger is not the problem, it's how it's expressed. And people often equate anger and aggression, but one's a behaviour and one's an emotion. So if there's anger, if you can calmly speak about it, by all means, a lot of people can't, need time. So, you know, you might say, hey, you know, when you said this before, I actually got really angry because it made me feel like you disrespected me. You could say it like that and still be angry, but not if you're triggered. So need the time to calm down. And even with kids, like when my son's been really angry and maybe as normal 3-4-year-olds do, they hit or they kick. In the moment, I'm not going to try to teach him because that's just like, again, he's not able to think. But later I might say, it's okay to be angry, but it's not okay to kick. Like, what can you do instead if you're feeling like you need a kick?
And those moments as an adult are the moments that you just said, like go and discharge, get that energy off, go for a walk, take space.
Yes.
Give yourself permission to, exercise is probably a great one with anger, or like journaling.
Yeah, whatever, rage on the page.
Yeah, love it.
Go for a fast walk. You know, whatever it is, everyone's going to find something different helpful. But checking in, like, do I need to dispel this energy or do I need to soothe? Because that will be a bit different.
I like that. Dispel the energy or soothe.
Yeah.
Because that's not something I've actually really ever heard of.
I don't know if it's talked in those terms, but I feel like anger does have an energy. Like
it does.
You can't often just be like sitting there with anger. You kind of need to do, like, you might notice your fists are clenching or you're tense, or like you might need to do something with it.
Well, I feel like when you try and soothe your anger, you're suppressing it. And so I like that really tangible explanation that when you're in that space, if there is energy behind your emotion, let that energy move.
Yeah.
Because, going into like a meditation and sitting with myself when I'm angry, I'm like, fuck this. You know, I don't want to sit. Like,
Absolutely.
it just amplifies it.
Yeah.
Thank you so much.
It's
for
a pleasure.
coming
It's been
on.
great.
Yeah, for sharing all your knowledge. Like, absolutely awesome. Just on close, do you want to just share some services and plug your services and stuff about if anyone was listening to this and maybe has a family member that's dealt with addiction or is feeling a bit like they relate to the trauma and the addiction side of things, what would the best point of call be for them?
Yeah, so there's obviously your public AOD service. So it will depend on your area where you're living. So if you call Direct Line, they can help you out to figure out which is the service closest to you. Their number is 1800 888 236. Obviously, there are private psychologists like myself who work in this space. Some psychologists will be listed on the APS Find a Psychologist website, and you can often put in like the topics, 3 topics you're wanting support with, whether it's anxiety, trauma, substance use. So that's a great way to find a psychologist, but not all psychologists are listed on there. Family, there's family drug help and other services. Where I used to work, which was Access Health and Community in Hawthorne, they have family clinicians. So I suspect there are other public services that also have family clinicians. Yeah, I think that never be ashamed to ask for help. Never be ashamed to reach out. I think that with addiction and shame, they thrive in the dark. Yeah. And so bringing it out, even if it's one person you feel comfortable to talk to, so important. There are people who want to help. There are people who care.
100%. And for anyone that's like interested in 12-step recovery as well, there's also NA meetings or AA meetings around your area. Just Google.
And I think that they're great because there's a sense of community. And I think even if people don't resonate with the idea of 12 steps, I often suggest go for a sense of community, even if you're not going to do 12 steps per se. You know, there are meetings at any time that even if it's online, if you're struggling and it's the middle of the night, I'm sure you'll be able to find a meeting somewhere.
And gain that social interaction, because I think addiction can thrive in isolation or with the wrong people. So that's there. Thank you guys so much for listening. If you've made it this far, please check Gabby out on her Instagram, chuck her a follow, or if you want to go and see her details will be in the show notes. And she is also works with people that don't have substance and addiction issues, that's solely trauma or just want some general psychology.
Yeah. Anything.
Anything.
Yep.
All about it. See you next week.